Hi, Felix. Esculapius, Simon, Quentin Lapius, right. Listen, I'm returning this call. This call is an answer to your email. You asked me why I promote primary care centers while there's a dearth of primary care physicians. And briefly, primary care centers will ease the burden of primary care physicians. Currently, primary care physicians have restricted their practices too often to referring patients and writing prescriptions. That's a common complaint. And when you talk to the physicians, they say, well, their insurance rates are too high, litigation is too promiscuous, and if they did office procedures, they'd have to face an increase in insurance costs for each procedure they did in their office. So it's the easiest thing to do is to write a prescription and refer the patients. Now I've been promoting a government public option, a single payer public option, limited to primary care for a long time, and the fringe benefit is the fringe benefit is that if there was such a system, then the scope of primary practice could become more uniform, because the government would define the scope of that practice. In other words, there'd be complete histories, physicals. The procedural medicine would include removing wax from a patient's ears, suturing a wound, doing minor surgery, taking out skin lesions, office dermatology, taking fluid out of a swollen knee, all of the things that we used to do. So the scope of private practice, the scope of primary care practice would be increased. The physicians would be on salary. The malpractice problem would be, the litigation problem would be solved, because the government would be making a primary care insurance contract with the insurers. It wouldn't be one doctor at a time, right? And the doctor would not be paying for his or her malpractice insurance. So here you have a primary care physician who's on salary, doesn't have to worry about the cost of malpractice insurance, is free to do the procedural medicine that doctors always enjoyed doing in the past. And this is a public option. The word option means that the public is free to go to these centers if they want, and they're free to take out primary care insurance from HMOs. That's what an option means. It's not the government taking over the healthcare system. Nothing quite as ominous. It's very simple, right? And I've described the other benefits of a primary care system in the past. Yes, it will reduce healthcare costs. It'll save a lot of money, but I've told you this in the past. I don't want to go over that. Just this simple extension of what I had envisioned. I'm quite yes, that a salaried physician protected from malpractice litigation under government auspices will draw primary care physicians into the system. There will be no dearth of primary care doctors, because medicine will once again become, medicine at that level will once again become fascinating, interesting, and fun to practice, right? Okay, I'll be interested to hear what you think. Right. All right, Felix. Take care. Talk to you again.